Well, good morning. We are on that health segment. You know, we do this every Monday. And once again, we're being hosted by the Pelvic Floor Neo Control Center. Really important that you join us through this conversation that is going to be helpful for you or to you, depending on how you want to say it. Now, we are going to discuss the urinary and fecal incontinence. I got it right this time round.
Sure.
If you watched last week's episode, then you probably understand where I'm coming from. So karibu sana as we get to this, important discussion. You get to know in a bit what this is all about. And joining me for the conversation is Dr. Alice Nyambura, who takes us through this and a really, really important conversation, especially to us, who could be suffering in silence. It is your time to speak out because indeed there is help. Just what exactly is fecal incontinence or urinary incontinence is what we'll be knowing in a bit. But first, to allow her to introduce herself and tell us what the Pelvic Floor Neo Control Center is all about.
Thank you, Linda, and welcome again to Pelvic Floor Center.
Asante.
Asante sana. I hope you had a good week.
That's the reason why. The good week. I thought you wanted to say, I hope I had a good session the other time. It was good.
Yeah.
That's why I am back.
Exactly.
And indeed, it was a great, great week and weekend.
Asante.
Asante.
So, karibuni viewers. My name is Nyambura Alice. I am a physiotherapist and more so a specialist in pelvic floor issues. We are here in Pelvic Floor Center to discuss. Today we are discussing about fecal and urine incontinence. Urine incontinence is when you cannot be able to control urine from as slight as leaking to complete loss. Yeah, so it varies with the degrees. Yeah, it might be a little leak, that is still urine incontinence. It might be complete where you have to use diapers, not even pads. Yeah, it might be as slight as using the liners. Then we also have fecal incontinence, is when you cannot control your bowel. Yeah, it is the same thing from the slightest to high magnitude.
Right.
Even when you're not able to control gas. Yeah, when you're not able to control gas, that is still incontinence, because your muscles are weak. So we have different causes. I don't know whether you...
Yes, let's go to that. If my memory serves me right, last week we were discussing the pelvic floor muscles. Sometimes you could be having a dysfunction of the same, and then this would lead to this. But like you rightfully put it, there are several of them.
Yeah.
And so we are keen to understand what are some of the causes.
Okay. So we have several causes. The first most common cause is what we call stress incontinence.
Okay.
Yeah, from the English definition of stress. Stress is when there is, I don't know how I'll explain it, when there is stress, something is stressing your muscles, like for instance, when you hold something, lift something up, you're stressing your muscles. So stress incontinence comes about when you stress your pelvic, your bladder through your pelvic floor muscles, they're not able to hold. They leak. You getting it? That is why we call it stress incontinence. So when you lift heavy items, you leak.
Okay.
I also talked about when you laugh hysterically, you leak. When I tell you, Linda, jump up, when by the time you're coming down, you come down and something else comes down.
When you're tensed?
When you're tense, that is another cause of tension,
Okay.
But it's different,
All right.
It's different from stress incontinence, because that one is psychological and all that,
Okay.
But this one is specifically now, the muscles are weak, so they cannot take any stress, that is why it's called stress incontinence. The muscles cannot take any stress.
Okay.
Some people even bending down, even when they're traveling, and then there's a bump.
Okay.
As you come down, it leaks because your muscles, you're supposed to come down and hold. So it comes down and something leaks. So that is what we call stress incontinence. We also have what we call urge incontinence. This is when you have, just as the name goes, urge. You have the urge. This is so sudden. Like when you're seated here, you're telling me, I have to go to the toilet. I have to go to the toilet. That is urge incontinence. The urge, you cannot control that urge. The urge is so much And most probably, when you run to go to the toilet, you don't even get there. Yeah, the urge comes, and you might find yourself overdoing it. The urge is so often, you wake up at night so many times because the urge is so much. You're having a your voiding is so much. Your bladder is overactive. So that is also another one that we call the urge incontinence. We also have overflow. This is where you experience frequent dribbling. Yeah. You just stay and your urine just dribbles, or you go to the toilet, you pass urine and you don't clear the urine. So as you're having your own activities, the one that had remained, it drips. Yeah, it drips down. Yeah. So that is what we call overflow incontinence. We also have what we call the functional incontinence. Functional incontinence comes about sometimes you might not even have so many issues. Maybe you're old and you go to the toilet, and when you get to the toilet, you're not even able to open maybe you have things like arthritis, rheumatoid arthritis or something of the sort. So you're not even able to open the toilet. So that is why we call functional. Right. Maybe you're wearing very tight jeans. Then you go to the toilet. By the time you're trying to open the zip and all that, and maybe you are lying down while trying to put on the jeans. Now you're standing and it's so tight. So that is what we call functional incontinence. Then we also have mixed incontinence. Okay. Mixed is either of them. You can have, which is very common, both urge and stress incontinence. Yeah. So that is why we call it mixed. So it might be a cause of either two. So like where you find that stress incontinence was caused by just weak pelvic floor muscles. Okay. Then this urge incontinence may have been caused by other conditions, like you have neurological conditions, you have diabetes, you had an accident, you're getting it. You have an injury. So that one can bring about the urge incontinence. Out of the 5 types, and I was on the mixed. Right. Yeah, and you get it. That is either of the two. So let's assume you had you already have weak pelvic floor muscles. Then to make it worse, again you get an injury which damages your nerves. So you have both. You have both mixed and stress. Let's also assume you already have the weak pelvic floor muscles, and you are wearing those tight jeans. That one you can be sure you'll not even get anywhere. Close to the door. Close to the door. Okay. So mixed is either of those. Yeah. So we have the 5 types. Right. But the stress and the urge incontinence are the most common. And mostly we are dealing with the stress incontinence. Here, our machine is very good when we are treating the stress incontinence because it's dealing with those weak pelvic floor muscles. Okay. Yeah, because they are not able to hold. We also deal with the mixed because you will find that you have now stress and urge. Yeah. So there will be a very good improvement because stress will be taken care of. All this is because of weakened pelvic floor muscles, which comes from our name, the pelvic floor center. Yes, yes. All right. Yeah. The causes of this are really important. Yeah. And I know like I said once again, we spoke about one of the causes last week. Yeah. But I would want to believe there are a couple of reasons why then one would have urine and fecal incontinence. The causes. One of the most... and now that you mentioned the types, would the causes then be different? Yeah, the causes would be different. Yeah. For different types? Yeah, because those are types. Okay. And the causes of all now these are different. Yes. And I know you mentioned them as you try to pinpoint. Yes. So some of them are just very obvious causes, like physical injury to your bladder or to your pelvic floor muscles. Maybe someone just decided to kick you or something, yeah? So they definitely become weak. So that is one of the causes, physical injury. Right. Maybe a fall, which damaged your pelvic floor muscles. As simple as that, the physical injury. Then we might have just weakened bladder. Weakened bladder. Your muscles are generally weak. They are weak. You might not really know the cause but they're generally weak. You try to get to know what the cause is, but you can't find a cause. So generally they are weak. Some of these conditions are also hereditary.
Oh,
yeah.
Okay.
Find that you have that kind of muscles. Your muscles are weak. Yeah, they are not able to hold. You have that kind of muscles. So hereditary is one of the common causes. You find that your sister has the same problem, or when you're going in a function, it's only your family that keeps running into the toilet because you inherited that kind of muscles. We have enlarged prostate. That is in men.
Okay.
Yeah, enlarged prostate because it will be pressing on the bladder. Yeah, it will be pressing on the bladder. So that is one of the commonest causes. So when maybe your old man starts running to the toilets so often, it is important to have him checked. It might be a red flag that something might be a problem. They need to seek help to know. And actually that is why they are advised to like have an yearly checkup. And especially men, after you get to a certain age, can you go and have those men clinics? Visit them. Don't wait until it is so late. Then you come and the doctor says, you didn't see any sign. What happened? And then you start be telling, I noticed I would run to the toilet often. It's been for like 3 years, and you're like, you had to wait all this long. So when you start having those signs.
Now, speaking of which, what are the signs and symptoms? Because, you know, when we talk about it, I almost thought it's as straight as, you know what, you're passing urine without knowing, you know, something like that. But I realized then that there are telltale signs that would get you worried before it gets worse.
Yeah, those are the signs that you keep running to the toilet.
Okay.
And it is actually, most urologists and the studies would say that when you find yourself going to the toilet more than 8 times
A day. Is it so?
Yes, more than 8 times a day, you start having question marks. Yes.
Okay.
Like Linda, sorry to ask you, how many times have you gone to the toilet today?
Today.
Yes.
Today, because of the work that I do, and sometimes I'm pressed, but I have to hold it.
Yes.
And so I've had to hold it like for the longest of time.
Yes.
Yes, so I don't think, I don't, maybe once in the morning when I woke up at 3 a.m.
You see?
Okay.
3 a.m. to this time, you're doing good.
Oh, good.
So there are people, since that time you're talking about, they have gone several times. So why haven't you gone those several times? And I'm sure you've taken a cup of water.
I've taken like tea, 4 by now.
You're still taking water, and you have not. If you have that problem, you can be sure, Linda, you would have gone to the toilet. Yeah? So that is a very clear indication there is a problem.
Okay.
And the problem is that your pelvic floor muscles have been weakened. They can't hold any longer. So we also have other causes, like we talk of prostate. You have other obstructions, like a cancer. You have a growth, any kind of a growth. Near the bladder, and it's pressing. Yeah? It's pressing on it. So that is equally another cause. We also have pregnancy.
Hey, man, women, we have a problem, I'm telling you.
We are strong.
We would have called God for a meeting because, you know,
Yes. Yeah, Linda, pregnancy. And that is why
The third trimester.
The third trimester. The baby is really pushing down there. The weight, Sometimes you're holding a 4-point-something baby. Yeah, that is a lot of weight, pressing down on those muscles, pressing down on your bladder. But the good thing is most of it, after you give birth,
it's done.
It's done. Unfortunately, sometimes it gets worse. Unfortunately, sometimes it gets worse because maybe your muscles were so weak and they already let go. Yeah, you get it. Sometimes you can stress something. Even you can. There are people who get so stressed until they let go. Yeah, that is now like we say amekubali depression. Yeah, the same thing. Our muscles can decide to be depressed. They were overworked until they let go. And that is why we always say, we always even advise mothers, when they are in that period, that continue doing the exercises so that you are strong to be able to hold and to be able to continue the journey until it's complete. But when the time comes for you to push, you will be able to push strongly because it is the pelvic floor muscles that push. And it saddens me to imagine how a lot of people don't know about these muscles. People know about these muscles.
We honestly don't. That's the truth of the matter.
And those are very, very strong muscles that have very important functions. The function of you staying decently without running to the toilet. You staying decently without smelling. You giving birth normally to that child. Those are very strong and important muscles that a lot of people have have forgotten. Yeah. So those are some of the causes. We also have UTIs, urinary tract infections. Yeah. So the good thing is when you get treated, you're good.
And treatment
treatment is there.
This cuts across something.
Sorry?
Something. Just say it first and then I'll come with
cuts
my
across,
question.
Sorry?
I wanted to say cuts across something, but then I realized there's a point you want to pass across.
Okay.
The sad thing. So I'll allow you to pass the point across and then we come back to my question.
Yes. The sad thing is when you don't seek help. Yeah? You get this infection. It eats on you. Until by the time you're going to get help, the damage is too much to be repaired.
So this was my question. It cuts across for the fecal and the urine incontinence?
Yes.
Those are the causes?
Those are the causes.
Is it not a little bit different with the fecal?
Yes, we will go to fecal.
Okay.
Yes. We'll go, just a little bit different.
All right.
Very slightly. But it's almost the same thing.
Okay.
So we talked of urinary tract infections. Yeah. So seek help, get medication, get treated. Don't be ashamed to go to your doctor and say this is what I'm experiencing down there. I'm seeing this. Yeah. Don't go to have over-the-counter medications. You just decide I'm going to buy any kind of antibiotics. Yeah, it's good to seek help so that they even know where is this infection coming from. How do we treat you? How do we advise you? What do you do next time? You get it. You don't just assume that it's just an infection. So sometimes the body tries to send us messages that we always tend to assume. So also aging.
Okay.
Yeah, aging. And as I said last time, I don't like when people think that when you're old, you have to experience all these problems. Yeah? You have to age and be happy and age gracefully.
That's true.
Yeah? And unfortunately, our muscles, as we grow, they tend to give in, yeah? But you can try to make it better. So that when, I know there are people schooled together, while the other one is running to the toilet, the other shosho is nicely seated. Because she has, you find her on the streets jogging and doing all that. Yeah, you see. Yes. So it makes a difference. Yeah. Psychologically, physically, she is fit. Okay. Yeah. So exercises is good. Even as you age, you will age with strength. You will not age with a lot of sickness. So basically, those are some of the causes, Linda. And before I forget, also neurological causes. You might have maybe. Let's talk of paraplegia. Yeah, where you have your cord severed. Yeah, you know our muscles are controlled by our nerves. All the muscles, all the actions I do, when I do this, it is the nerves, what we call the motor nerves, that are controlling it. Yeah, so our muscles are controlled by our nerves. So when our nerve that supplies the blood and all that are affected, they let loose. Yeah, so those are some of the causes that cause urinary incontinence.
Before we even go further, I'd love to understand the difference in this. When you're growing old, again, to what age? Because normally we'll see the kids, they will just susu on themselves. And maybe I don't understand whether at that point the muscles are not as strong, or maybe it's just that the kids are not aware of the existence of the muscles. And how do you get them to understand that at this point then you can hold it and you don't have to susu on yourself? And at what age should a parent be worried that, you know what, my baby now has surpassed that age. It's almost 6, 7, but they still are susuing on themselves. And sometimes even in bed.
Oh, thank you very much. We have what we call milestones.
Okay.
Milestones, and that is what you're talking about. Milestones are the stages where you say, now my baby is smiling, my baby is cooing, my baby is crawling. Yeah? Same thing. Some babies, as early as 1 year and above, they would have already stopped peeing on themselves. Yes. And it also depends on the training. Yeah? And those will take as long as 4 years, depending with also the training. Yeah? So when the baby is able to take instructions, proper instructions, you've trained them on potty training and all that, that baby should be able to take control of themselves. You see, because they are at that, the milestone allows them, the stage allows them to be able to take control of it. However, some babies might be so traumatized, yeah, traumatized. Maybe they are being traumatized by issues at home. Maybe at school they are traumatized. Maybe even you as a parent, you're traumatizing your own child. So that fear, even adults, the adults who, when they're so scared, they will pee.
It's true.
They will pee on themselves. That is why you've seen some people doing exams and they pee. Yeah, because it's so much psychological. So this child might not really have a lot of issues, but it's all psychological. So if you find that your child is like 5 years, they're still peeing and pooping on themselves, try to establish the real cause of that problem. Yeah, they might have a medical condition, they might have, but sometimes it's just psychological. Yeah, we also have something we call pseudo. Pseudo is something that is not real. Pseudo is fake. Yeah,
Pseudo the name.
Yeah,
yes.
pseudo. Yeah,
yes.
itself. So you tend to think that this child has that problem, but when you go and do all those tests, nothing. And mostly when you have this pseudo, maybe pseudo paralysis or pseudo anything, it is mostly psychological. So you really have to get to know what is the core issue of this problem. And you really, at some stage, that is when you need to get worried. But it also depends with the training. How early did you train your child? So if the child is still 2 years, 3 years, you don't need to worry. But if you train them, they will be good with time.
Would you then say that you can as well treat, this condition where you find people as old as 20, 30, are not able, like they're easing themselves in the bed, like they spoil their beds at night?
Yeah, so the same thing. That is really psychological. They really need to get psychological help. And you find a lot of them, if you as a parent, you don't stand with your child, you're the first one, let's assume it's your daughter, who is in a certain, maybe she got traumatized, maybe the house help used to traumatize this child. So already it became like a habit.
Okay.
And instead of helping this child, you're making it worse. So when there are visitors, now you're shouting, you again, you've urinated. How old are you? Look at yourself. Look at your small brother. They're not urinating on themselves. You are a big girl now. It makes it worse. It makes it worse.
Okay.
Because it's psychological and they start feeling like they're not worth and all that. And the more you feel you're not worth, the worse it becomes. So if you're not working with your child and getting to know what is the real issue,
right.
What is the real issue? When they go in, like some of them even in high school, I know, some in high school they still wet beds. Yeah. So when you go there and you make sure every teacher knows this girl is wetting their bed, every child knows they are wetting their bed, it becomes worse. But if you work with that child and let them know that you're working with them, it is a condition that is happening and they will get better. I can assure you they will get better. Because it has nothing to do with the anatomy. It has nothing to do with the anatomy. It is all psychological. If not so, also get to establish if there might be other problems. But mostly it is psychological. Yes.
All right, briefly before we get to the treatment, you say there's some little aspect of difference when it comes to fecal incontinence.
Yes. As we talked about fecal is when you're not able to control your bowel movements. Yeah. It might also be from slight to
extreme.
Yeah, extreme. Slight to extreme. So that is the difference now, and also the bowel sounds.
Okay.
Yeah, the bowel sounds. So it is not very common, but it's equally common. But it's very common when it comes to bowel sounds. And as I had last week, I talked about the same thing, that you'd find someone is seated in a meeting and they are passing gas. And people are wondering, what's wrong with this person? Don't you have manners? And that tension, as we were talking about urine, it also again makes it worse. Yeah, it makes it worse. And what it does, the quality of life really goes down. Quality of life really goes down. Because even when you're in that meeting,
you're not comfortable, you're worried, you're tense.
You're listening to yourself. Yeah, you're thinking you will release something. So you don't even perform.
That's true.
Yeah, you will not perform. So it really affects the quality of life. So that is the difference now, fecal and urine. Fecal is the fecal matter. You're not able to control it. It might have as simple causes as maybe you are having diarrhea. Yeah, you've heard of these cases of cholera. I used to hear they even used to have a hole around there and lie facing down so that when it comes, it just goes down. Yeah. So it doesn't mean that you have a problem with your bowel, but now the situation is dire. Yeah, we also have constipation. Constipation. You know what happens is the fecal is too hard for it to pass out naturally. So you strain your muscles. If you don't seek help and start eating well, eat a lot of roughage, and then don't hold it whenever you feel like going. That is again what people do there. You want to go to you were supposed to go and ease yourself, and you're not doing it. So the large intestine keep on taking the water away. So it keeps on getting hard and hard. And what do you do when you go to the toilet? You start straining yourself. You strain your muscles until they can't hold anymore. Yeah. We also have some other situations, sadly to say, the way God created us. I am sorry to talk about it. There is a function for everything. There are some people who might use the wrong places for the wrong functions.
You need not to be sorry. Yes.
Yes. You end up destroying those muscles because they were not created for that function.
Okay.
Yeah. Some people use the anal part forceps. Let me call it as it is. So you end up misusing the muscles.
That's true.
Yeah. So what happens? You loosen those muscles. Yeah. And it's one of those cases of where they start getting that fecal incontinence and a lot of hemorrhoids. Yeah, because those muscles are not well, and a lot of infections. Yeah. So we also have a muscle damage. I gave an example of maybe you have paraplegia. You know, the nerve has been severed. Nothing much you can do about it. You will get treatment, or even you're having severe paralysis of one side. So it means some muscles that control that function have been affected. So what happens is, until you treat the cause, if it's maybe you're having a clot, until that clot is nicely resolved and all that, then you go back to normal. But what happens is when they were already weak, the clot might resolve and you still find the problem is persisting because the muscles were already weak.
Okay.
Yeah, that is where physiotherapists, that is where we come in.
All right.
To remind the muscles, this is what you used to do. So you start teaching that person how to again exercise those muscles and make them strong. Yes. Yeah, that is what happens. Yes, because you will find that maybe you have had a cerebrovascular accident and the problem has been solved and you're still weak. Yeah, because the muscles forgot. Yes.
So it's just that
you re-educate them.
All right. So how about we learn some bit of what needs to be done so that one can re-educate the muscles in the practical aspect?
Okay.
Thank you. Briefly, I know we might not be able to do this because we do not.
So let me then mention a few others as we go to do the practical part. Yes.
Please.
Yeah, and I will not elaborate much if you want the practical, but briefly, like surgery, some surgical procedures.
Okay.
Yeah, some surgical procedures might lead to that, or whatever kind of surgical procedure that was involving some of the areas, or even a surgical procedure that involved the brain. You know, the brain controls everything. So we have surgical procedures. We also have what we call the rectal prolapse. Yeah, where you find your organs have, it's like coming down, crumbling. Yes. So when it prolapses, it starts pushing down there, you know. So immediately you end up having that fecal problem. So those are some of the causes. Okay. Yes.
All right.
Yes.
Okay. So we take a quick breather and then we cross over to the other side and just have some lessons on what, of course, it takes for you to get that treatment after this break. Welcome back, and remember, we're still at the Pelvic Floor and Knee Control Center, and the topic of discussion this morning is urine and fecal incontinence. Something that we all struggle, you know, a majority of us, will be struggling with it. And of course, they would not want to go out there and speak. This is the time for you to speak out because you know what? There is help. Help has been there, but you probably kind of feel like, you know what, it's shameful to speak out. But it's even more shameful if you have to smell, if you have to struggle every time that you're sitting in a meeting and, you know, you can't concentrate because you're worried that before you know it, there'll be urine on your pants. And so it's really important that you go out there and seek help. And the beauty of it is when you're told that indeed there is help. So still here is Dr. with me so that she can take us through some of the processes that you go through now at this point where you've decided it's all right. I am out here. I'll seek medical advice. You've been diagnosed. And, have to go through the process of treatment. She'll be telling us what is, going to be done to you to make sure that you're well. The process is how long it would take. We just get to see whether you'll get that assistance. Dr. back to you.
Thank you. Linda, this is the best part of the interview. Yes, the practical part of it. I'm sure we all love the practical part of anything. Because that is where you learn what you were learning in books. Now you bring it to practical part of it. And this is now the famous eczema seat that we were talking about. You see, it's very decent. You've not undressed. Actually, we need a magazine. Yeah, there's a magazine here.
Bring it on.
Yes, a magazine for you to be reading.
Oh, yeah?
Yeah. So it's there, as we said, it is non-invasive and non-surgical. You see, there's nothing there are no probes. Yes. Probes are those things that people put inside there. Yeah. So it's very decent. Yeah, yes, it's very decent.
This is the mug.
Yes.
Even though I know I won't read it as such because then I'll be getting tired.
Yeah, normally we give our clients a magazine or a newspaper so that you relax. Okay. Because there is no pain, you can concentrate. It's okay, sorry about this.
It's all right, no problem.
You can concentrate, there is no pain, there is no distractions. You can even decide to just think about sleep if you want. You'll be for 20 minutes.
20 minutes.
Yeah. 20 minutes. This is what we call the eczema. Eczema in full means extra corporeal magnetic innervation. Extracorporeal, I'll give you an example. When people go for dialysis, there is a machine that does the cleaning and all that. It's not the body that does it, a machine that works for your body. That is extracorporeal. Yeah? Maybe you have a pacemaker outside your heart that helps your heart to, those people, I hear some people walk with things that help their hearts to pump, So that is the extracorporeal. That is something that is outside but will be helping your body to function.
Right.
Yeah, those muscles which were weak and you're not able to work on themselves. That is how we retrain them from something. You get it? So that is what we call extracorporeal magnetic innervation. Magnetic because it emits magnetic waves, the eddy currents, and they're very safe. You don't have to be scared. Some people would say, maybe I would get cancer after that, maybe I would get what after that. They are very safe. Actually, I always tell people all our physiotherapy equipments are very safe. Yeah, there's nothing to get scared about. If they were emitting something that is dangerous, I would be covered in a different way because I would also not want the yes. So yes, the emission. So this is very safe. Yeah, very safe, very decent, and works very well.
You want us to speak about the pricing?
Yeah, it's very affordable. It's very affordable actually. Very, very affordable, Linda. Prices range from one session is around 5,000, depending with the sessions and depending with the severity. Like I told you, it treats different conditions. Yeah, we have like hemorrhoids. Those ones they clear very fast. Around 3 to 5 sessions, and you're done. Instead of first of all seeking that surgical intervention. Actually, that is something that was very important. I should have mentioned. Before you go to the next step, you start with this simple step, simple step of don't go for the surgical, try this first, and the results will be good, I can assure you. So it depends with the severity. So very affordable, from 5 to around 150 or even less. 5,000 to 150 or even less. You can imagine someone who has erectile dysfunctions and all that, and they're having issues. Just a few thousands, and you bring what happiness back, the glory into your home, and your woman will be saying, "This is the man." Yes, and the man would be saying, "This is the woman." Yes, exactly. So
I am told that before you do anything, when you step here, when you're sitting on this seat, you do not have to have anything metallic on you.
Yes, to avoid the interference, you remove all your keys, you remove your wallet, you remove your belt, your watch, any jewelry. And you also void, as in you go and make sure your bladder is empty. Because what this is going to do is going to do the exercises for you. Those exercises that you hear of Kegels, normally I also teach Kegels exercises because I am a physiotherapist. Yes, I teach Kegels. And I told you, first of all, I have to make sure you get to know which are the core muscles because we have core muscles down there. Most persons, would think doing Kegels is a way you move. When you're doing Kegels, you cannot see a movement because it's deep down there. So when you tell a person do those movements and you see them doing that and you see movements, they are doing the wrong thing. They are doing the wrong thing because when you're holding your urine, you don't need to press on anything. It's down, deep down there.
It's deep inside you.
Yes. So first of all, for a lot of women, it is so hard to get to know those muscles. Yeah. And then when you're doing Kegels, when I start taking you on Kegels, when you don't want the seat, you will have to do like 3 times a day and a number of sets, maybe around 50 sets every time you're doing it. And do them correctly, Linda. Then for around 6 months for us to get results. Actually 6 months or even more. And a lot of people give up. That's why you see some people, they start going to the gym, they are not losing, they lose. They just, yes, exactly. They are like nothing is happening. So the good thing with this one, it locates all your muscles. We used to have probes as I told you, but they will not go so deep. This one goes so deep, the way your muscles are is a dome shape, and it creates what we call the eddy currents deep down there, creating contractions, strong contractions. Because when you have the weak muscles, when we tell you to do the contractions for yourself, sometimes you might not achieve strength. So this seat gives you strength and endurance of your muscles. Strength and endurance, because it does around 18,000 movements in 20 minutes that you'll be here.
Let's feel it.
So 18,000 movements. How long do you need to do them? I want you to be counting me how many you're doing. Because we always tell you when you're standing in a bank or you're sitting, you can be doing the Kegels. 18,000. How long?
You will lose count.
And that is one session. And it's strong and it targets on all the muscles. Yeah? So with a few sessions, from like the 5th session, the 7th session, you're already experiencing the wonder. You're already experiencing the wonder and you get done with it, and you're like, wow.
I'm already waiting.
Yes, yes. So as I told you, this seater was established, or the founder is a German doctor. He's actually a urologist. You know, a urologist. Urologists are those people who deal with maybe someone has prostate, has fistulas, has those conditions. Those are the urologists. And he established it because he was getting a lot of women with that urinary incontinence. And a lot of them, he used to have that probe. So most of them would even refuse to go for the treatment, because you can imagine every time you're going to the doctor, we don't like even those examinations of gynaes, and it's just a one-off. You're like, it's a one-off. So every twice, thrice a week, something is being inserted there. So a lot of women would feel like, very uncomfortable, very like it invades on your privacy and all that. And that is how he came about with this. And that is why, when it worked, that is why he started introducing it to other countries. As I told you, this is the first in our country, the second, the first being in South Africa, and the 60th in the whole world. So we are doing good,
We are
doing good,
yes. Innovation is life.
Innovation, yes, exactly, yes, exactly. So Linda, I will set you off. You will feel a movement down there, because that is where we have the head. Yeah, this is our CPU. This is where everything is. This is like the head, and now the function is down there. So as we do it, you will also try to position yourself well, to target the muscles. And being that I have not seen you running so often to the toilet,
yes,
I think we are doing good.
We're doing perfect.
So what we want to target is what we call the vaginal tonus. It's equally good. If you become better, if you come better and become better, is there a problem? Let's tone it some more. Sure. So I will start off. So we just start by putting on. Then we have different protocols, Linda. It's not a one size fit all. I've seen some people go for some treatments. Everybody is getting the same treatment. Everyone is getting the same treatment. You have incontinence, you have hemorrhoids, you have, this one works with different protocols. If your case is hemorrhoids, we have a different protocols. If it's vaginal tonus, we have a different protocols. If you have erectile dysfunctions, we have different protocols. After that, the prostate was removed, so we're also trying to work with it. We have different protocols. Yeah, so we have different protocols for different conditions. Yes.
All right.
So
can one come sit here when they are on their menses, or maybe they have family planning, say coils and all that?
when you have coil, that is what we were talking about, metals.
So that's
when you have a coil, that is, we call it contraindications. Yes, when you have a hip replacement, you have something on your the back, spine. Those metals is a contraindications, unfortunately. But when you have your menses,
that's fine.
It's okay. It's fine. Yeah. So we have indications, we have contraindications. That is how we call them.
See, this is the beauty of it all. You can come sit here and
Yes.
still get help when you have
Exactly.
your menses. That's life.
So we are going to give you protocol too that deals with the tonus, and you will feel a sound. So don't.
I feel like a sound there.
Yeah, down there. So don't jump. Don't jump. And then as you sit, you know your body.
Yeah,
so position yourself so that the right areas are targeted.
Okay.
Exactly. You see, the right areas are targeted.
So can I sleep? No, I can't sleep because we're live. We're doing this.
No, you can't sleep because you're live. Otherwise, I'm sure you will come for more sessions. You'll come for more. So that time we'll give you permission to sleep. Yes. Okay.
So how long before I start feeling something?
Yeah, we are in it. Can you feel that?
Wait a minute.
Yes.
It's not funny, my people. Alright, so I am now psychologically prepared to start.
I know you're feeling like yeah. So it's supposed to, and sometimes Linda, do you mind me even trying to position you better?
Please position me, no problem.
So try and come like this. Move back.
Okay.
Try and put your legs like that. Right. Just open. I'll make sure you're decent enough. Open your legs, kidogo.
Right.
Then come like this. You feel the effect? You feel the effect?
Right. So.
And then even those, sometimes they just put one leg there, the other one there, and then the effect is targeted, and you relax. Can you feel that?
Let's do that.
Yes.
All right.
Yeah. You're decent enough. You can add some more.
Okay. So it does. Okay. So it's once and then it stops.
Yes. Then Linda, now I have put it at the first session. It's 20 minutes, but it goes for 10 minutes. 10 minutes, yeah? Okay. There's a time it will give you a break. Because the exercises you're doing there, Linda, you might not really feel them. Okay. But I told you it's 18,000 movements. That is a lot. That is a lot. Yeah. And sometimes we tell a person, the next day, if you feel like you're feeling anything, relax, it is okay. Because assume today you started running. How do you feel the next day?
It's always
so your muscles are being exercised. Yeah. So don't worry. Actually, sometimes when you have an incontinence, the urine incontinence, the next day some of them say it's like I had some more urine coming out because the muscles were not used to that kind of exercises. So they are a bit tired. Okay. And when you tell me that, I tell you, I'm happy. Now it means it's really working on you. It worked on those muscles. They are a bit tired. And now they have been conditioned. From there, they will start getting used to it. And that is why you're told, you go for exercises once you feel the pain. Don't give up. After some time, the lactic acid will go. You get it?
Tomorrow I'll have some bit of pain?
Not a bit of pain. Not everyone experiences. Okay. You might tell me you're feeling, you're feeling yourself. Okay. That is very normal. Because the exercises you're doing there, but after that, your muscles now start getting used to marathon. You know, it's like they're running. Start getting used to it. So it gives you a break of 10 minutes. After 10 minutes, it gives you a break of 2 minutes to relax you, so that the muscles zitulie, so that you can take maybe a cup of water. Assume you are running. A cup of water, a stretch kidogo. Yeah. We are doing it. We are saying practically if you're running, but that is like what the machine tries to do for you. Then, being your first sessions, the second phase, I will reduce it. It was at 100. I will reduce it so you will feel it a little. Because this first day, I don't want to overwork your muscles. You get it? Then as we continue, as you get used to it, now we will be working like throughout on 100. But being the first few days, we first 100, then we reduce to around even 20. So that your muscles get used to that marathon. Yeah? Yes. So, Linda, how are you feeling?
Wait a minute. You don't even lie to us that you don't feel anything.
You're feeling,
I am feeling
yes.
something. I can literally feel like I'm being cool.
Exactly.
Kind of
yes.
That is how it's supposed to be.
That is how it's supposed to be. It's working on your pelvic floor muscles.
Okay.
So, with that, Linda, you cannot get a prolapse. A uterus prolapse. Right. With that, you cannot leak. With that, it is very difficult if your problems of miscarriages and all that are coming because of weak pelvic floor muscles. You will not have those things. With this, in fact, it is very good if you feel like you're weak and you're preparing to get pregnant, because again, when you're pregnant, you can't sit there.
Health conditions. When you're pregnant, what else?
When you're pregnant, you can't sit over there.
In communicable, in talk non-communicable, everybody have
the other conditions. Actually, it is not contraindicated to, apart from different kind of cancers, other cancers, but like prostate is allowed. The contraindications are very few, because what you're doing, you're only exercising the muscles. Not unless you're having problems with the bleeding, yeah? You know, like you're having problems with the bleeding. So it might make you bleed more, because it is again overworking those muscles until that problem is fixed. When you're having infections, you can't come. You have to go and get a treatment for that first. So those are the questions you come and we ask you. Are you having any infection? Have you had any surgery? What kind of surgery? Are you having any conditions? Are you on any medication? Because we want to know, before we sit you on that seat, we want to know you're very safe. Okay. Yes. So just very few contraindications, because it's generally exercising the muscles. Yeah, but we also have our contraindications: infections, bleeding. Yeah, when you have a metal inside there, when you're pregnant. Yeah, so before pregnancy, you can always come and make sure your muscles are strong. Then when you get pregnant, now we show you exercises off bed. And actually, Linda, after you finish these sessions, we give you a home program. Yeah? That now you need to continue exercising. You see? Right. This is an exercise of your muscles. Okay. So when you finish it, your muscles are already torn, but you need to continue exercising. So we teach you on now Kegels, which you will be able to really do very easily, because you can already feel them and they have already been started off. Right. So that you keep on maintaining. You don't go to the gym, then after some time you give up.
So how soon do I come after this? Maybe after the first session, how soon do you come?
Alternate days. Yes,
but
with hemorrhoids, you come every day for like 5 days and you good. Yes. Yes.
Man, you go out there and seek treatment. And like you said, age gracefully.
Exactly. Age gracefully. Yeah, because we don't have these issues. We don't have these issues of want to release these issues. They call them to show us. Yeah, they are thinking sasa mama amezeeka. No.
And mama pia kubali anasema ni sawa tu,
usipeane ruhusa. Please come. Yeah.
Deep down you're hurting, but
unapeana ruhusa, because even you feeling like you're not up to the game.
It's not even expensive.
Yeah, exactly. Yeah.
What else is there to? You know, I'm literally talking and I can feel the pulse. So
that's nice.
This is just it.
This is it. Okay. Actually, you've gone like how many minutes?
6 minutes 43 seconds. All right. Well, I'll come for the 10-20 session Sabbatha time. This was just for me to tell you how it feels like, and it feels good enough. And honestly, I feel like I'm being pulled. I'm waiting to see what then will be the after.
Yes.
Or the aftermath. All right. Asante sana.
Karibu sana. I'm thinking you should finish the session.
I am finishing the session.
Yes.
But we're closing the program.
Okay. So have we closed?
Do we close?
Okay, let me say where we are found.
Yes, please.
Linda, we are found in Modaiga Square, along Thika Road, just at the roundabout, opposite Modaiga Police Station. And we call ourselves the Pelvic Floor New Control Center. We're found in first and second SWAT. And our contacts are 0721 342477 or 0791 270 298. You can email us at info@pelvic floor centers. Thank you. Ready to work with you.
You know, see, what I always say is this, that on Morning Cafe, it's not just about having this conversation, but equally going out there in search for help on your behalf. So that when I present to you, then you're able to say, okay, well, I am going through this difficulty. And, you know, on Morning Cafe, I was able to see that I can get help. So why don't you proceed? Watch this session. And I know there are many of us who are out there and probably going through the troubles that we're talking about. Yes, we have talked about urine and fecal incontinence. Yes, so please, if you have that problem, take your time to go and visit Dr. You probably are going to get assistance out of it. Thank me later, as I always say. It was good having you. I get to see you again tomorrow. And on that very note, I finish my session. Bye-bye.